says, how often do you preform thigh lifts? Now, you and I both know that should be perform thigh lifts, so we're going to just gloss over that. How often do I perform thigh lifts? Hardly ever. I hardly ever do thigh lifts. And there are a couple of reasons for that. One is that thigh lifts aren't that common. Are not that common an operation. When you're looking at body contouring surgery, which is usually following either weight loss or pregnancy, or putting on losing weight, stretches the skin, and you're left with redundant skin once you've lost weight. And the sort of body contouring operations, things like face lifts, breast lifts, arm lifts, thigh lifts, tummy tucks, out of those, the arm lifts and the thigh lifts are much less common than the face lifts and the breast lifts and the tummy tucks, because the scars of those operations can be hidden, and the scars of arm lifts and thigh lifts cannot be hidden, and so it is difficult to kind of reconcile that, because you're often doing it for cosmetic reasons, that you don't like people seeing your thighs, and then we give you a big scar, and you might then not want people to see your thighs because you've got a big scar. So you're trading one cosmetic thing for another cosmetic thing. So that's the first reason why I don't do many, because it's trading one cosmetic thing for another thing. I have that conversation with everybody before having a thigh lift. Therefore, a lot of patients don't go ahead and have surgery, which is fine, because I'd rather that than I do the surgery and then they're unhappy with the scar. And the other reason is because of the way that I do thigh lifts is with a big visible scar, because there is a way to do a thigh lift without a big visible scar. There is a way to do a thigh lift where you hide the scar in the groin. And there's a lot to be said for it, because as I just said, you've got one cosmetic problem. And the way I do it, I put a big scar down the medial aspect of the thigh, down to just above the knee. And that's obvious in short skirts and shorts and things like that. So having the scar hidden, you would imagine, would be very appealing. And so that a lot of patients would prefer the way where you hide it in the groin. However, I don't do that type of thigh lift. And the reason I don't do that type of thigh lift is because I don't find it does a very good lift. I don't find it gives a very good result. And the reason is, I know that is because I've done it in the past and it's not given a great result, and it's quite an expensive operation. And it's not great when you're trying to convince a patient they've got a good result when they're still saying, oh, I've still got skin laxity and what have you, because a thigh lift, when you are using the scar that's hidden in the groin, kind of pulls the skin up in an upward direction. It tightens the skin in the upward direction, whereas the excess is usually in a circumferential direction. So that's why the one that I do is much more effective at tightening the skin, because it takes that sort of cylinder of skin. It takes a big wedge out of that cylinder of skin and really tightens the skin around the thigh, which is much more difficult to do if you're trying to sort of tighten the cylinder by taking it in an up direction. So the one that I do gives a much better thigh lift, but it gives a much more obvious scar. And so some people don't want that obvious scar, and I can understand why they want the one which is hidden in the groin, but I don't do it mainly because it doesn't give a very good result in my hands. I think people do it, and maybe they've mastered the technique. So I always say, look for someone who does it and gets good results, because that would probably be someone who would be better to do that than myself, because I find that it doesn't give a great lift. The other problem with it is it's a difficult scar for healing. You can get delayed healing. It's a hot and sweaty area in the groin. You can get it can pull at the sort of female anatomy a bit and cause issues down there, and it can cause stretch scarring, and so there's other issues, but they're not the main reason that I don't do it. The main reason, because I could kind of live with those if it gave a good lift and a hidden scar, but it just doesn't give a good lift in my hands. So I don't do that sort of scar where it's hidden in the groin. I do it with a big scar down the medial aspect of the thigh, which means that I don't do many. I don't know if that means why I don't do many. Maybe it's just because well, I don't know. I don't know why I don't do many, but that's why I don't do many. I just find it's not a common operation. We don't get many people asking about it. Maybe there's someone out there who kind of specializes in it and does loads, but not many people specialize in that sort of thing. Breast, body, face. There's quite a lot of surgeons specializing in those things because they're quite common, but the thigh is not that common. So that's where I am on thigh lifts.